Okay. So the Association of Anesthetists of Great Britain and Ireland regard it as essential minimum standards of monitoring adhered to whenever a patient is anesthetized. So this is the standard guideline that has been given there, and these standards should be uniform regardless of the duration, location, or mode of anesthesia. That is what you mentioned about whether it is general, regional, or
Yes, sir.
monitored anesthesia care. The first and foremost is the anesthetist must be present and care for the patient throughout the conduct of anesthesia. That is what is the first requirement or the minimum monitoring requires. The qualified anesthetist should be present throughout. And the second is minimum monitoring devices that are defined by the recommendations later must be attached before induction of anesthesia, and their use continued until the patient has recovered from the effects of anesthesia. And the same standards of monitoring apply whether it is local, regional anesthesia or sedative techniques also. And a summary of information provided by all monitoring devices should be recorded on the anesthetic record. This is a very important thing. All of us should follow this very meticulously. And automated electronic anesthesia record systems also provide a printed copy if you in a sophisticated machine. These are available now. And the anesthetist must ensure that all anesthetic equipment, including relevant monitoring equipment, has been checked before use. And alarm limits for all equipment must be set appropriately before use. And the audible alarm should be enabled. You should not switch off the audible alarms at any time. And the monitoring devices that are essential must be immediately available during anesthesia, and it is absolutely necessary. If it is absolutely necessary to continue anesthesia without an essential monitor, that should be made note of in the anesthesia record for a particular brief time. Patient pulse oximeter was not there or ECG was not working. That should be documented. And additional monitoring may be necessary as judged appropriate by the anesthetist, and minimum monitoring should be used during transfer of the patient also. It is not only during the anesthesia, but transport also you have to monitor the patient. And the provision, maintenance, calibration, and renewal of equipment are the responsibilities of the institution in which anesthesia is delivered. And the institution should have process for taking advice from departments of anesthesia in the matters of procurement and maintenance of any anesthetic equipment. All patient monitoring and anesthesia equipment, gas supply, suction should be checked before you start the case or start giving anesthesia. And minimum monitoring for recovery from anesthesia includes pulse oximeter, non-invasive BP, ECG, capnography if the patient has a tracheal tube or a supraglottic airway device in situ, or if the patient is deeply sedated, and temperature. These 5 things become mandatory. Uh, then, when anesthetists are called to administer general anesthesia or regional anesthesia or sedation outside the operating theatre, for example, in emergency department, cath lab, radiology department, electroconvulsive therapy suite, endoscopy suite, pain clinic, dental clinic, or labor room, the same minimum essential standards of monitoring should apply. And in cases like cardiac output monitor, depth of anesthesia monitor, or neuromuscular block monitor with nerve stimulator are recommended whenever indicated, but they do not come under minimum monitoring standards. So only for specialized surgeries you are using, but in the upgraded 2020 or 21 guideline, they are including neuromuscular blockade monitor should be available in the theater. Even if you are not using it, it should be available in the OT. And anesthetists should have immediate access to capillary blood glucose monitoring. This is another updated version that is given in the revised guidelines. And patients with diabetes mellitus who are controlled with medication should have their blood glucose monitored intraoperatively at least every hour during surgery. And patient should also have, anesthetist should also have ready access to capillary blood ketone monitoring equipment. And because hospital acquired diabetic ketoacidosis is the third most common cause of diabetic ketoacidosis after infection or lack of compliance to the treatment. And with the usage of SGLT2 inhibitors, this euglycemic acidosis is very becoming very common. Ketoacidosis of euglycemia is very common with this. So nowadays they have included this capillary blood ketone as well as blood glucose monitoring available in required cases. So these are the guidelines that I was able to pick up, and I thought this will be more appropriate than the answer that you have prepared. Okay,
Okay. Yes, sir.
so I think you can follow this instead of